Welcome to Open BXRx on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. This week, we have a new feature here on Open BXRx, where medical professionals join us to provide insight on how you can be healthier. Welcome to the Whole Health Report, sponsored by Empire Blue Cross Blue Shield. Today on the Whole Health Report, we're discussing the risk of COVID-19 for people with underlying conditions. I'm happy to welcome Dr. Craig Hirsch, the Chief Medical Officer at Empire, and Jasmine Rosales, Social Work Case Manager at Empire Blue Cross Blue Shield. Dr. Hirsch, Jasmine, welcome to the show. Thank you so much for joining us this morning.
Hi,
Thank
thank
you
you
for
for having
having
us.
us.
Of course. First off, Dr. Hirsch, can you please tell me more about why Empire decided to team up with BronxNet for this whole health report in order to discuss health issues here in the Bronx?
Absolutely. So our mission at Empire is to materially and measurably improve the health of all New Yorkers. And we say to ourselves, where better to do this than right here in the Bronx? Teaming up with you and BronxNet gives us an opportunity to reach people that we really want to be in touch with so we can be part of the solution.
Thank you so much, Dr. Hirsch. And we're happy to partner with Empire Blue Cross Blue Shield to have this incredible platform for our residents, especially during this time. We know that our borough is especially challenged by health issues, Dr. Hirsch, probably more so than many of other boroughs in surrounding New York communities. Can you tell us more about these health issues here in the Bronx?
Yes, no, you're right. So the Bronx is challenged. You have a higher incidence historically of medical conditions that are considered chronic, things like asthma, diabetes, high blood pressure. And those things only became worse during the pandemic. The Bronx tends to have worse outcomes for those conditions overall, even before a pandemic. Of 62 counties in the state of New York, the Bronx ranks 62 when it comes to health outcomes. So there's plenty of work to be done.
Right. And Dr. Hirsch, how has COVID-19 exactly exacerbated these health issues? What are some of the most common underlying conditions besides asthma and diabetes? And how have people with these conditions been affected through the pandemic?
Yeah, it's affected it in a couple of different ways. First off, especially during 2020, it made it very difficult to access care. And so other conditions that people have may have festered a little bit or gotten worse. The second thing is that COVID brought about illness upon illness. So if you had these underlying conditions, you were much more likely to have a worse outcome. I'll give you a couple examples. When we talk about diabetes, which is highly prevalent in the Bronx, the mortality rate, the death rate increased by 24% in 2020. And when we talk about high blood pressure, the mortality rate increased by 40%. So these were unexpected things that we were going to see as a result of COVID. Now, we also saw from COVID itself, more significant outcomes in the Bronx than in some of the other boroughs. And part of the reason for that is there's a high density of population. There's a lot of people living in multi-generational homes, and there's a lot of people serving on the front lines. And you put all those together, and it's sort of a recipe for spread of the virus.
Some very staggering statistics. Thank you for sharing, Dr. Hirsch. I want to learn, how does Empire and your team help people here in the Bronx get the help that they need, especially during these times?
Right. So that's the secret sauce, right? And we help in ways big and small. And sometimes it's strictly on the medical side. So maybe someone has trouble filling a prescription or taking their medicine, or sometimes they have trouble accessing care. But oftentimes it's the things around the care, the emotional, the social, the financial, things that contribute to bad health outcomes. Our case managers and social workers have done some incredible things, some amazing things. I've seen them work with patients who have something like asthma, multiple visits to the emergency room, multiple admissions, and they can't figure out what's going on. And as we peel back the onion and we work with those folks and get to know them, what you find out is sometimes it's environmental factors, sometimes it's mold in the home, and they're not exactly sure how to remediate that. And as we start working with them, we're able to help solve those kind of problems.
And that brings us right to our next guest here. Jasmine is one of those social case manager workers at Empire Blue Cross Blue Shield. Jasmine, thank you so much for joining us. I wanted to ask you to tell us about your work as a social worker here in the Bronx. Dr. Hirsch kind of, touched upon what some of those issues are that maybe residents are not sure of, but you help them, get through that. Can you talk about, being from the Bronx and also working here in the Bronx as a social worker?
Of course, thank you so much for having me. So my job here as a social worker in the Bronx is definitely a daily adventure. I mean, I love every bit of it. Bronx is my second home. I'm originally from the windy city of Chicago. I moved to the Bronx a while back, and it reminds me of home. I mean, I grew up in a low-income neighborhood where resources were very little, and unfortunately, the health conditions were at an all-time high. Nonetheless, I am a Bronxite and a New Yorker at heart. So my role actually entails helping our members, especially Mi Gente of the Bronx, with linking them to community resources.
Mm. And Jasmine, can you share some of those resources and services that you typically provide Bronxites with?
Oh, sure. So as Dr. Hurst mentioned, there's a lot of like psychosocial factors that exacerbate health conditions. And one of them, and I help Bronxites members with applying for transportation, medical transportation through Accessoride and other local transportation companies. I assist and help them with applying for low income housing or help them with their current situation, housing situation that can entail from mold removal to maintenance issues. I call on their behalf to their mortgage companies to enroll them in financial hardship programs. I'm able to assist them apply for financial assistance through various New York City organizations for our members that are diagnosed with core conditions such as asthma, cancer, diabetes, and so forth. Making sure that their gas and lights and electricity are not cut off by calling their prospective electricity companies and helping them with the financial assistance there, linking them to food assistance through community organizations such as Get Food NYC or local food pantries, helping them with lower cost prescription programs for especially for our asthma diabetes members, since Bronx has the highest percentage of diabetes members, which is at 16% right now, or since the pandemic, basically. And then helping them apply for Social Security Disability and Medicare. I mean, the list can go on, Sonji. You
Mm.
know, it can
Wow.
definitely go on.
No, social work is super important, especially during these times. And even before
Mm,
it, as you and Dr. Hirsch mentioned, Jasmine, these issues have already existed in our communities here in the Bronx.
yeah.
So, thank you to Empire for providing all these services and resources to our community. I wanted to also ask you, how has COVID-19 impacted your work? And, how has it changed for you as a social worker?
Well, where do I even start? I mean, COVID-19 has definitely, the assistance and the need has greatly increased. More members are in need, they're more vulnerable than ever. Outside of the resources that I just named, I believe like financial assistance has doubled for our Bronxites members, as well as linking them to community outpatient mental health treatments. See, my mantra is I don't believe in saying no, Sonji. Like I will exhaust every option. I will advocate to ensure that Bronxites members are linked to resources to help them with their daily functioning. If I could just alleviate one stressor for one member, then I have done my job.
That's the Bronx mentality right there. And, that's why
There you go.
we extend you and we welcome you into our community. So thank you. Dr. Hirsch,
Of
I want
course.
to loop you back into the conversation. Our viewers may be listening at home and they want to know where they can access these resources. Can you provide, any access to the information, any resource links and more? Also, COVID-19 vaccine updates, doctor. We want to take advantage of having you here.
Yeah, so everyone's concerned very much about the COVID vaccines right now. And the first thing I want to say is I strongly encourage everybody who's eligible to go and get that vaccine. It is a sort of shifting table right now. It's hard to know exactly where to go. Resources are helpful. I would highly recommend that people go to nyc.gov. The other place that I would recommend people check is empireblue.com. And you can always call 311 as well. So in any way that we can be helpful to you, like Jasmine said, we'll be there to help you.
Thank you so much, Dr. Hirsch, Dr. Craig Hirsch, the Chief Medical Officer at Empire, and Jasmine Rosales, Social Work Case Manager at Empire Blue Cross Blue Shield. Again, this is the Whole Health Report, a partnership sponsored by Empire Blue Cross Blue Shield. Dr. Hirsch will be joining us a little more regularly every month, providing you health updates regarding, COVID-19 and other conditions here in the Bronx, information that you need. So thank you both again for joining us today.
Thank you.
Thank you very much.
Again, we look forward to having you back, Dr. Hirsch, at the Whole Health Report from Empire. Thank you both. We'll be right back.